Partial or complete empty sella on CT scan or empty sella syndrome or MRI is one of the diagnostic criteria for Sheehan syndrome, Turner syndrome, Meckel Gruber syndrome, Williams syndrome. The sphenoid bone is divided into a central portion and two pterygoid processes. The superior part of the sphenoid bone is a saddle-like sella turcica. Sella turcica refers to Turkish saddle because of the shape and function of a seat or a saddle. Like the Turkish saddle, which has a broad seat, high pommel, and cantle, the sella turcica has tuberculum sellae, a saddle-like depression for the pituitary gland in the middle, and the dorsum sellae formed by a square plate of bone on the body of the sphenoid. The sella turcica is usually round and oval with height larger anteriorly in females by 0.5 millimeter. In Sheehan syndrome, there is postpartum pituitary necrosis due to severe hypotension or shock secondary to massive bleeding during or following delivery. It is diagnosed by partial or complete empty sella turcica on CT scan or MRI. In Meckel-Gruber syndrome, the sella turcica has a wide base in the dorsum sellae with irregular shaped notochondra. In Turner syndrome, the sella turcica appears larger and more open cranially. An empty sella is often an incidental radiological finding with no evidence of any hormonal deficiency, although it can be associated with variable degrees of hypopituitarism. The term primary empty sella syndrome is used when no identifiable cause can be found. The majority of the patients are asymptomatic. Elevated intracranial pressure is believed to be an important contributing factor, and 10% of the patients with benign intracranial hypotension also have empty sella syndrome. So the empty sella syndrome doesn't equate with Sheehan syndrome. So the right side shows the normal sella and the left side empty sella. The answer is A, and these are the references.